All right, welcome to The Explainer. Today, we're stepping into what you might call the mind's pharmacy. It's a place filled with some really powerful tools, right? Tools designed to tackle some of the most complex conditions medicine has ever faced.
So, how do you even begin to medicate the mind? I mean, that question has been a huge challenge for doctors and scientists for decades. And the answer? Well, it's not some magic bullet. It's actually a huge and constantly evolving collection of medications that go right to the source, the central nervous system.
Think about it this way. Your brain is this incredibly complex orchestra of chemical messengers. Now, if they get out of tune, that can lead to some really profound distress. So the drugs we're going to talk about, they're like the keys used to retune that orchestra. We're going to explore how they work, who they can help, and, just as importantly, the serious risks they carry. Okay, let's dive in. So here's the plan for our little tour. We'll kick things off with the basics. Then we'll walk through the major classes, antipsychotics, antidepressants, mood stabilizers, and we'll wrap up with a really crucial look at side effects.
Okay, first up, the brain's chemical keys. So what's the actual principle behind all of these medications? How do they really work inside our brains? The key thing to get here is that these aren't just simple sedatives or something. No, they are highly specific tools designed to adjust the brain's own chemistry. They target these chemical messengers, called neurotransmitters. You've probably heard of some, like dopamine and serotonin, and by doing that, they can completely change a person's mood, their perception, and even their behavior. All right, our first stop on the tour, antipsychotics. These are the medications used mainly to treat psychosis, which is a key feature of conditions like schizophrenia. Basically, they help reduce things like hallucinations and delusions.
The story of antipsychotics is really a story of evolution. It started way back in the 1950s with drugs that, they were effective, but they came with some serious side effects. So each new generation that's come along has tried to be more targeted, to improve how well they work while dialing back on that burden.
And this is where you see this really interesting trade-off. The first-generation drugs, they were powerful dopamine blockers, but they often caused these severe movement disorders. Then came the second-generation drugs. They added serotonin into the mix, which helped with those movement issues. But it introduced a whole new set of risks, like metabolic problems. We're talking weight gain and even diabetes. And you can really see that complexity when you look at the side effects of those first-generation drugs. I mean, the burden was high. We're talking everything from sedation to those really debilitating movement disorders we just mentioned, known as EPS. It was a really difficult balance that doctors and patients had to navigate. Okay, next up on our tour are antidepressants. Now, this is probably the class of drugs most people have heard of, but the story behind them is actually way more complex than you might think.
Yeah, not all antidepressants are created equal. Not by a long shot. This table breaks down the 4 big classes. And while they're all aiming to treat depression, how they work and the risks they carry are just worlds apart. The older ones, the TCAs and MAOIs, they came with some huge risks. I mean, TCAs could be fatal in an overdose, and MAOIs could cause a life-threatening spike in blood pressure if you ate the wrong foods.
And that is exactly why the development of SSRIs, that selective serotonin reuptake inhibitors, was such a game changer. Think Prozac, Zoloft. By focusing mainly on just one thing, blocking the recycling of serotonin, they offered a so much safer alternative. It made treatment way more accessible and just dramatically cut down the danger that came with those older meds. All right, now we're moving on to a medication that requires an absolutely incredible amount of precision. It's a treatment so delicate, it's often called the lithium tightrope. And this is a real cornerstone for treating bipolar disorder. And that name, the lithium tightrope, is no exaggeration at all. Lithium is a super effective mood stabilizer, but its safety, its entire safety, depends on keeping the amount in the bloodstream within an incredibly narrow window. And this is it, 0.6 to 1.0. That's the therapeutic range for lithium in the blood. The margin for error here is just unbelievably small. So here's exactly why that tiny window is so critical. If your level is below 0.6, the drug just doesn't work. It's ineffective. In that sweet spot, that narrow range, it stabilizes mood. But if you push it just a little bit, past 1.5, it becomes toxic. We're talking confusion, tremors. And if it goes above 2.0, it can be fatal. It's that serious. Of course, the mind's pharmacy is a huge place, right? So let's make a quick stop to touch on a few other key medication classes. And this covers a huge range of conditions. You've got anxiolytics like benzodiazepines, Xanax, Ativan, which can bring down anxiety really fast. But, and this is a big but, they have a high risk of addiction. Then you have stimulants for ADHD that work by boosting focus. And for Alzheimer's, well, the medications we have today can really only hope to slow the disease's devastating progression. They don't offer a cure.
Okay, for our final section, and you could argue this is the most important one, we have to talk about risk. These medications are a double-edged sword for sure, and understanding the potential side effects is absolutely critical for keeping patients safe.
There's this classic little phrase that medical students learn to remember a certain type of side effect. Can't see, can't pee, can't spit. It's memorable, right? It describes what are called anticholinergic side effects, which were super common with the older antipsychotics and antidepressants. It's talking about blurred vision, urinary retention, a super dry mouth, all these uncomfortable symptoms from blocking a neurotransmitter called acetylcholine.
And this brings us right back to that trade-off we talked about with the early antipsychotics. Extrapyramidal symptoms, or EPS, are honestly some of the most distressing side effects you can imagine. Everything from this unbearable can't-sit-still restlessness called akathisia to really painful muscle spasms. They are the main reason that newer drugs were developed in the first place.
And look, some side effects aren't just uncomfortable. They are genuine medical emergencies. Neuroleptic malignant syndrome, for example, can cause a dangerously high fever and muscle rigidity. Then there's agranulocytosis, which is strongly linked to the drug clozapine. It can literally wipe out your immune system. And of course, as we just saw, lithium toxicity can be fatal. All of these require immediate, emergency medical help.
So after this whole tour, what's the big takeaway? It's that these drugs can be absolutely life-changing. They can offer real relief from incredibly debilitating conditions. But, and it's a huge but, they are not simple cures. They are incredibly powerful tools that demand this constant, careful balancing act between profound benefit and very serious risk.
And that leaves us with one final thought. We've seen how these medications have evolved from, these blunt instruments into much more targeted tools. So as our map of the brain's complex chemistry gets more and more detailed, you just have to wonder, what new doors will the next generation of these chemical keys unlock?